I'm Dr. Russell Libby, and I welcome you to the world of medicine. You know, from the moment a child is born, we start thinking about those milestones that separate us from the rest of the animal kingdom. Of course, smiling and cooing are important, but it's nothing like those first steps. And of course, those first steps turn into walking, turn into running, and it becomes sort of a symbol for all the things we do in the world. We are able to get around, we go on fantastic journeys, and not only from a practical point of view, from a literary point of view as well. We hear the cliches, oh, you got to stand up on your own 2 feet. Oh, he's barely got a leg to stand on. Oh, there he goes again, putting his foot in his mouth. Well, our feet, our ankles, our legs, they get us around. And things that happen to them sometimes can cause some significant disability. And when that happens, our lives often get turned upside down. And it's really hard to appreciate until you experience them. Sure, we all have things like ankle injuries, sprained ankles, stubbed toes. Sometimes we might get more severe injuries, things that might be a fracture. Some of us, when we're chronically athletic, we might incur injuries that be like stress fractures and things of that nature. Sometimes we get inflammatory diseases, arthritis, rheumatoid arthritis, gout, things that will cause our joints to hurt and really disable our ability to walk. Now, some things can be very severe as well, things that require joint replacements, things that require significant surgical approaches. We're going to talk to a remarkable group of people who have very interesting stories to tell about what has happened to their legs, to their feet, to their ankles. And we're going to hear their stories and get the commentary of our experts. We have Dr. Matthew Buchanan. He's an orthopedic surgeon who specializes in the foot and ankle. He works at Orthopedic Foot and Ankle Center, which is brand new offices now just opening here in Merrifield, really close by the studio here. A phenomenal facility from what I can see looking at the videos of the new exam rooms. We have Dr. Evetta Borden. She's a podiatrist. She takes care of people with significant problems like diabetes and other kinds of skin and nail and different types of foot problems that really are important. Certainly diabetes, as we'll discover, is a very, very important condition that we need to talk about because there's so many people who are affected by it. And we have several other people from the office here. Matt Bernier, who's a physical therapist. He's going to tell us about some of the things they do to rehabilitate. And we have Marcia Graden, who is an orthotics specialist. She helps fit people with the kinds of things that support their feet and make sure that they can walk and give them the right kind of shoe wear. We're going to find out a little bit about our first. Cindy, you've had foot problems for a long time?
It was about a year before I ended up having surgery, but about 3 years ago I started having a lot of pain in my right foot, just only my right foot, and the right toe. Started out with not being able to wear certain shoes, and eventually the pain just got worse and worse till it really got to the point that every step hurt, and I finally decided I need to do something about this.
So this wasn't something that was bothering you from early childhood?
No.
It was something that sort of gradually evolved?
Right.
And the kind of pain you had was primarily in a toe? Mm-hmm. And that was your big toe?
Big toe in the ball of my foot area.
In the ball of your foot, okay. And how did that, it got worse and worse over time? You couldn't wear any kind of shoes that worked? At first you thought you could probably wear different shoes that might make things better?
Right, and busy mom, active, you know, I just kind of procrastinated and really didn't pay attention to it as soon as I probably should have because it got worse. And it just was painful all the time.
All the time. And what happened? How did you get diagnosed? And what happened
I went
then?
to my primary care physician who took an x-ray, and I had osteoarthritis in my big toe. And I knew Dr. Buchanan because I worked at one of the hospitals that he practices at, and so decided that I wanted to go see him, and that's what I did.
So you had the big name as that big foot specialist
right,
out there.
I knew he was good.
Yeah, okay. So at that point, were there options? Did you try things?
Mm-hmm. We did a steroid shot. And we did x-rays, and he told me I was kind of down to bone on bone in my big toe, and that's why I was having the problem. And I couldn't bend my big toe, so walking, you know, when you're walking, you need to bend your foot, and when you can't, and you're forcing that because you're, you know, putting weight on it, that's where the pain was coming from. And so we did a steroid shot, which helped for a little while I kind of thought about doing some surgery, and then ultimately did surgery.
So the surgery is what worked?
Absolutely.
Yeah. Well, we're going to hear a little bit about what kind of surgery. I'm curious, Because you say you have arthritis in a toe, and that's couldn't be an uncommon condition. It sort of evolved later in life where you were very active and athletic.
I was. For a while, I ran, I exercised. Then it got a little bit more sedentary, but why it was just in one toe, I don't know.
Yeah, so you never remember injuring it, but you might have at some point or another. And the kind of pain you had, was it there overnight? Did it wake you up at night?
It did eventually, toward the end.
Towards the end. And then during the day would be how in the morning? And would it get worse through the day?
It would definitely get worse through the day as I was on my feet and walking a lot. It would, be a little bit less in the morning, but it didn't take very long for it to
So by the end of the day, it was up in the air, you had some ice on it, you were trying to do anything
absolutely.
to make it feel better. It never got swollen significantly? Did
No.
it get hot?
Nope.
Never got
just pain.
hot? Just pain. It was mostly towards the end. As the more you used it, the more it hurt. Okay, so that's a pretty classic story for arthritis. And I ask Dr. Buchanan, we have a pretty good story, arthritis. Yeah. Do we see it a lot in the adult population?
It's amazingly common, especially in the big toe. So it's a condition called hallux rigidus, and it's an arthritic condition that tends to affect younger, healthy, active patients. We see it a lot in our running population is a real big one, dancers. Anybody who does a lot of push-off, toe-off with their foot, it's actually surprisingly common.
Yeah. And what age do you start to see that? I mean, obviously you have genetic or injury predispositions, but on the whole, for those who aren't so predisposed?
You can see it as early as your 20s when it starts to develop, but typically the patients that were, performing surgery and doing injections and stuff on, 30s to, let's say, 50s. So sort of the prime of your life, and it can be quite debilitating.
It's very painful. And the first way you approach those things is with an x-ray, as she had described?
Absolutely. So we're going to make our diagnosis with a good physical exam. We see the stiffness she talked about, the pain with trying to move it, occasionally some swelling. X-ray confirms that loss of joint space, which is what arthritis is. And initial treatment will start off with maybe some shoe changes, some activity changes, maybe some inserts for the shoe. Will kind of be first line. Cindy, we ended up doing a cortisone injection for, which helps, but a lot of times that's temporary relief.
So how long do those things work if you do end up getting a steroid injection? How long can they help you, and at what point do you know that this really isn't going to make the difference?
Typical positive response from a cortisone injection can last up to 3 months.
Okay.
So.
And then they come back for another.
Exactly.
And then they come back a little sooner for another.
Yeah.
And you say, we got to start to think about something else.
Absolutely.
Yeah. So you have a way to start and a way to look at it. So chronic joint problems that cause arthritis. Now, there are other types of arthritis, and she was describing what is pretty classic for an osteoarthritis,
right,
as they call it.
So we can see another very common form of arthritis we see in the foot and ankles, post-traumatic arthritis. So that's the athlete that in high school had repetitive ankle sprains that ends up with wear and tear arthritis in the future, 10, 15 years down the road. We do also see some types of inflammatory arthritis, whether it's rheumatoid arthritis or any of the other inflammatory conditions that can affect the foot and ankle. But most of the time it's osteoarthritis or post-traumatic.
And the inflammatory arthritis, those that are associated with certain autoimmune diseases, as they call things like rheumatoid arthritis, they have sort of a different presentation. I mean, obviously you have some family history possibly, but the way they experience the pain day in and day out and the effect on the joint and your perception is a little different. Tell us what you see that way.
Agreed. So like an inflammatory arthritis will be, the joint by the name will be more inflamed. So it's more redness, more swelling, it's more diffuse. So in Cindy's case, it was really isolated to one joint, and inflammatory arthritis many times will affect multiple joints. We're seeing, like I said, the redness. The presentation's a little different, where the wear and tear arthritis tends to be worse with activity, where the patient with inflammatory arthritis will wake up in the morning sort of stiff to begin with before any activity. So those are some of the diagnostic keys to, what's inflammatory arthritis, what's more the osteoarthritis, the wear and tear arthritis.
We often hear about infectious sorts of things, and of course in this area and over the last couple of years, of course, Lyme disease has become a very significant concern for people. Can you differentiate a little bit what we might see, and do you see it in the big toe?
Honestly, we don't see that often Lyme disease affecting the big toe. They might have the characteristic rash and stuff upon presentation, maybe a history of a bite of some sort, but it doesn't classic presentation for Lyme disease wouldn't typically affect the foot and ankle.
So it's the bigger joints, the knee,
Exactly right.
the elbows, those wrists sometimes. Okay, so that's good to know. And typically they're feeling worse when they have that as well.
Absolutely.
So it's always something to keep in mind, no matter where you get joint inflammation. If it gets red, it gets swollen, and it hurts, that's always something to keep in mind.
Definitely.
Yes, and so, of course, if ever you have the opportunity to have to go to someone to get that kind of information. You've had a different kind of story. You had some congenital issues.
I did. Well, I like to say I did.
You did, good. That's a great way to say it. Yes.
I was born with extreme flat feet, and my dad's a doctor, and so ever since I was young, my parents, they took me to specialists, and I had ugly orthotic shoes. In my day, they were very ugly, but I had orthotics. I had probably orthotics for every day of the week, and I did my best, and my parents just kept taking me to specialists, and they said that's the way her feet are. I kept walking on the insides of my feet, and I just got used to the pain. And later on, when I went to college, I remember freshman year, I got to the point I couldn't really walk, and so I went and got the cortisone shots, and it was very painful, but my personality, I didn't let people know how much pain I was going through, and I realized that there are people that don't have feet, so I was grateful I had feet. So I played sports in high school, and I just kept grinning and bearing it, and that was my lot in life, I thought. And one of my doctors, actually, and I remember when I first went into Dr. Buchanan, I just remembered he brought me in, he looked at my feet, and then he had his whole staff come in, and he said, look at her feet. And I was only 20 years old. He said, the whole staff came in and said, her feet are like a 70-year-old person's feet. And that made me very sensitive. Made me sensitive.
Making you sensitive right now, I can see, yeah.
It made me sensitive because I already knew I had a hard time, but I didn't like having everybody know it.
It was validated pretty thoroughly there, yes.
And when I was thinking about my life for the show, I remember walking across campus one semester, and I would trip on nothing, and my feet would give out. And I thought, what's wrong with me? I mean, I was good at the drop and roll and get up and look around
Right,
and
yeah,
think,
okay.
I'm okay.
Chevy Chase there,
exactly.
Right, yeah, you got it.
And but I just kept going, and even though I had that, I just remembered, keep going. And I even tried running a mile under 10 minutes, and I did it in pain, and I did it. But I knew that it would, that was life.
Well, you had a big cross to bear, didn't you? You carried it with you a long time. Well, and Dr. Buchanan, so we're talking about a congenital deformity.
Absolutely. So Aubrey had, she's basically your story of someone that is born with very, very flat feet. That as time goes on, the flatness of her feet wears down both the joints and the tendons. So as she's describing, she's living her life with pain because of really the flatness of her feet.
But can you show us at all what that would mean and sort of how it might look on your model there at all?
Absolutely. So one of the important structures that holds the arch up is a tendon that we don't see on this model that comes right around the back of the ankle and plugs into the middle of this foot. So in this model, we can see a relatively beautiful arch. This is really the way the foot was designed. In Aubrey's case, when you do this side x-ray, literally this arch was completely collapsed, totally flat. And the problem is that puts extreme stress on this tendon, as well as all the ligaments that are designed to be in this arch shape. That flatness of the foot is destined to cause lots of foot and ankle pain.
And I want to know a little bit more about how that ends up manifesting itself, because it seems to me, and as a pediatrician, I see a lot of kids with what looks like flat feet, but when they sit down and they have their feet off the floor, there's a nice arch. Or if they get up on their toes, there's a nice arch. But they pronate, as you say,
Right.
Their ankle goes towards the ground. And in certain types of shoes, their feet look awkward. Is that the same kind of thing, or is that a less severe, or is it really a benign sort of process?
That's a great point. So the question is, what we're forced to determine is what's the difference between a normal, flexible flat foot. So in children, they might have a flat foot, but as you described, they can walk on their tiptoes, and they have the arch recreates, and normal heel inversion. and they look at their mom and they're saying, hey, I don't know why you brought me in here, like my feet don't hurt. They can run, jump, play, no problems. Aubrey's situation was a little different because not only was she starting to lose some of the strength in her foot, but her feet on a daily basis, despite all the standard treatments, orthotics, shoe changes, physical therapy, she still said every day, my feet are killing me. So that's a big difference between the flexible, normal flat foot and what we really talk about as kind of a pathologic flat foot.
So it is pain. Pain is
absolutely.
And you could you get up on your toes at some point?
I could. I actually, believe it or not, I took a year of toe shoes, toe dance when I was younger, and it was painful. And I thought, no, this isn't for me. So I tried. I did a lot of things, but it came to a point. I was playing ultimate frisbee on the beach with some friends, which I love to do, but there was more pain than usual. And again, my dad being a doctor, I called home and said, something's wrong. And he said, you need to go see another specialist. And miracles happen. I moved to DC about 8 years ago, and this summer I've put the pieces together of, it was a leap of faith move. I moved here, didn't have a job lined up. My sister was moving here, and I actually used to rollerblade in Dr. Buchanan's. And this isn't a made-up story, but this is true. I lived a block from his office, and I used to rollerblade at night in this parking lot because it was a big parking lot, because I love rollerblading. And this summer, actually, after my second surgery, I asked him, how did you get into doing this? And he is one of a few in America, and I'm so grateful. I'm just very grateful because
that's great.
It's changed my life, and it's helped me appreciate, like you said, every day we take a step at a time, and when you're slowed down, we can choose to either become better because of it. And I'm just grateful that Dr. Buchanan took the time, and I'm grateful for the people that are here that have gone through such hard things. But we're smiling now because of it, and it's been worth it. I would do it again. It's the hardest thing I've ever done.
I bet.
To have my feet broken and put back together, but he was a master, and I'm so grateful that he's around.
So
the master.
So she tried all the different things, and of course, one was basically trying to ignore, and then two was trying to find the right shoe wear. Fortunately, she had a dad who could help by at least giving her some relief on a temporary basis, but over time it got bad enough so that she really needed surgery. What kind of surgery do you do for that? I mean, obviously, if your foot is off and you're carrying weight, I mean, they say, what, you in a day, just with ordinary walking, you probably put 1.5 tons on your feet.
Absolutely.
In terms of stress and pressure. I mean, obviously, all of that force goes right down to your feet. And those bones and joints, there are 28 bones, 30 joints. That's a lot of place to distribute all that force, but if there's something out of whack, it can really throw everything out of whack.
Absolutely. So her surgery is what we call a flat foot reconstruction. So again, not a small surgery, and Aubrey will tell you, despite how great she's doing now, it's not an easy recovery process. So we're really reshaping and rebuilding the foot. So in her case, what we're doing is essentially, her foot was so flat that instead of having this nice shape to her arch, as you looked at it, had collapsed, and all the bones were pointing off to the side. So we really went in and did a lot of bone work. So we cut bones on the outside of the foot and lengthened the lateral border or the outside of the foot. We do some work on the inside that brings the inside down. This recreates an arch. We work on this tendon on the inside here to strengthen and repair it. And we actually have to do some lengthening of her Achilles tendon, which, because the foot has been so flat for a long time, becomes contracted. So we're talking major reconstructive surgery on a foot here.
Now, you were pretty stoic for all those years, but you had to use anesthesia for the surgery, right?
Thank goodness.
Yeah. And your recovery, was it really hard?
It was. Going into it, I knew it was going to be hard, but nobody tells you how hard it's going to be. And I think everybody here that's been through it, or something similar to it, you physically, mentally think you're prepared, but when you're facing it and your body and your mind aren't connecting, and I remember looking at my toes thinking, come on, move. Come on, foot, move. And nothing was happening. It's hard. And then to deal with the pain for such a long time, your feet,
Well, you had a lot of work.
It was a lot. And then to know I had to go through it again, I'm grateful I did, because one of the things that I told him, I said, I'm single, I want to get married, I want to have a family, and I want to run and play with my kids someday. So the fact that he said, you'll get through there, it's worth it. So
That's fantastic. And you were a pretty active young one yourself.
Yeah, I was a gymnast, and I have a black belt in Taekwondo. I ran for many years and had a lot of ankle breaks, and found Dr. Buchanan through Dr. Bruno here in the McLean area, and he didn't feel like he could do anything for me, so he referred me to Dr. Buchanan and said, listen, I think you're going to need surgery, but the only person I trust is Dr. Matthew Buchanan and Dr. Neufeld. So I went to see Dr. Buchanan, and I had an MRI that was like my last exam, I guess, to show how bad my ankle was. And Dr. Buchanan, as soon as he saw the MRI, he's like, you need to have a sublateral ankle replacement surgery, right? Yeah.
You got that down pretty well, yes,
yeah.
that's for sure, yeah.
And then, and I said, and I had gotten to a point about 4 years ago where I couldn't walk anymore up the stairs. I had so much pain, and I could literally like feel I had arthritis starting in my left ankle and could feel the bones actually rubbing against each other. So Dr. Buchanan and I just decided, let's do the surgery right away. And I went into it not really knowing how long it would take. But I had gotten to a point where I wasn't even walking very much anymore, and I was just very lazy sitting around because the pain was excruciating. And I had started to gain weight, and I just was very depressed because I was always very on the go and very athletic and always at the gym every day. So I had the surgery done, and I guess during the surgery he found out there was, I had more spurs, and he needed to clean up the ankle more. And one of the things he did was he drilled 2 holes in the front of my ankle where the cartilage, I guess, had deteriorated, and cartilage doesn't regrow, so blood flows in there, and over time it causes scar tissue, and so it kind of replaces the whole cartilage to help where the ankle was grinding against each other.
So it gives it a surface.
Yeah, do I get a job now?
Very good.
And then after I got out, it took a long time. I had to stay at an incline because of where the position where the cartilage was forming. If you drop your foot or if you step on it or anything, it could mess up that whole formulation, I guess, that's happening. So thank God I have a first floor master bathroom, and my mother and I had a person I hired help me. That's the hardest recovery time, not having somebody close to you to be there for you. And I was very fortunate to have my own business, so I could work from home, because if I had to work for somebody else, I don't think I could do it.
So as a child and doing gymnastics, you were doing a lot of high force landing on your feet. You would
vault, trampoline.
You'd see them limp away after
beam.
doing something,
Yep.
and then they'd come back and do the next set.
Exactly,
and you were dedicated and committed. And
yeah, and I sparred a lot. I was, I got my black belt at a young age, and I used to spar on a national team, and I broke my ankle 3 or 4 times growing up. I think it started to get weak, but I didn't really feel the post-traumatic arthritis till later, as I got older. Yeah, I still was running, but it just, over time, it just started like getting to a point I stopped running.
Yeah. So, gee, we have a pretty intense story there. Athletes will do these things to themselves. As we heard, they keep trying, keep figuring it's going to get better. When a child sprains their ankle, these kinds of things sort of start to set up. Tell us a little bit about what happens to the ankle in these traumatic situations. And she was talking about the surface and about the cartilage and things of that nature, just to help people understand what that means.
So, anytime we have an ankle sprain, what we're talking about is essentially a tearing of the ligaments that connect the leg bones to the foot bones. So, let's say in childhood, when the ankle is sprained or rolled and these ligaments are torn, we want to make sure that they heal adequately and are treated appropriately. what can happen with athletes like Mina that are into martial arts and gymnastics is repetitive spraining of the ankle can end up with ligaments that are stretched and torn such that they no longer function properly. What we worry about is that as that ankle is sprained, you can see just by this very position, we're starting to damage the cartilage that lines these joints. So that's what Mina was dealing with, is basically a series of ankle sprains bad enough that she had caused cartilage damage in the ankle.
And as opposed to muscle and some other things that you can actually heal and regenerate, the cartilage just won't do that.
Correct.
And once you do what you did for her, you drilled holes in the end of the bone so that you get some scar tissue there to give you a little cushion, huh?
Exactly. So it's a technique that's called microfracture. It's very common in athletes. So when you have a focal, meaning relatively small loss of cartilage in a joint surface, by drilling it, it promotes the ingrowth of what's called hyaline cartilage. So it's not quite as perfect as, you know, the native hyaline cartilage that grows in, but that scar cartilage is great for pain relief and for longevity of the joint.
Fantastic. Well, that's good to know. I guess I have some hope for some of my knees and some of the other things, but we'll find out more. Now, you had a different kind of experience.
I did. I had a very bad bunion.
A bad bunion?
A bad bunion. And when my friends and I would talk about our bunions and we would look at each other's bunions, mine was the very worst always. I won that contest every time. It took years to develop. It started when I was a young woman. The shoes that are in style now were in style then, with a very high heel and the pointed toe. And it forces your foot into a very small space. And over years, my big toe turned toward my little toe at 45 degrees. It stepped on my second toe every step I took. And one orthopedic surgeon told me that I should just buy shoes to fit my feet. Well, there were no shoes to fit my feet.
No stylish shoes, anyway. That's for sure, yes.
And though there was a little impression of my toe sticking up there in the middle of the shoe. It became very painful over time. But I didn't think I had any recourse. Then one of my friends told me that she had had bunion surgery at the Foot and Ankle Clinic. It was a wonderful experience, and everyone rushed to tell me how very painful bunion surgery is. And of course I was worried about it, but Dr. Neufeld told me that they have better techniques now and better medication. And I was tired of having my foot hurt all the time.
It really hurt.
It did. It really hurt. So I had the bunion surgery, and he was right. The pain medication took care of it, but I only needed pain medication for 3 days. And after that, I didn't use it anymore, and the recovery went very well, and the swelling takes a while to go down. It's a little disappointing to have to wait 4 to 6 months to wear pretty shoes. But
you're back to them.
I am back to the pretty shoes.
And I'm sure you know that better than anyone.
Absolutely.
Yeah. So was that what she would ask you when it wasn't how the dress looked, it was how do my feet look in these shoes?
Yes.
Yeah. Until
and you were very careful how you answered.
That's true.
That's
true. So we've got what probably is the most common pre-surgical condition in the country, which is women's feet as a result of them trying to squeeze into shoes that don't fit and have the absolute wrong anatomic angle for them to have normal bones. Tell us a little bit about what we see there.
So women are 8 to 9 times more likely than a man to develop a foot problem as a result of shoe wear. So obviously the societal pressures on women to be in these cute shoes with the high heels and the narrow toe boxes really does produce a tremendous amount of problems with the foot in terms of pain, in terms of bunion development. We do know that bunions really don't occur in these limited populations across the country that don't ever wear shoes. In the developed countries where from birth we're all in shoes, the percentage of patients that develop bunions is 30 to 40%. So it is surprisingly common and, as Jean can tell you, very painful.
And Dr. Borden, when you have bunions, you don't always end up having to have surgery. And that surgery is pretty radical. I want you to show us in a minute a little bit about that. But what are some of the things that people can do once they start to notice that that bone is starting to bump out and it's starting to get a little tender?
once it's starting to get tender and once they notice that it's changing, most of the time when you see it on one foot, it's usually from a trauma, so you had some type of injury there. One of the things you can do is come in to a foot specialist so that we can get you in orthotics. Basically, it's a muscle imbalance that's causing the problem. So if we can get you into custom-made orthotics so that we can control the foot and negate that imbalance of the muscle, then we can stop the bunion from forming. As Jean said, she went years and years and years watching it get a little bit worse, a little bit worse, a little bit worse, the shoes getting a little stretched out, and then finally saying enough is enough. But if you catch it early, there's a chance that the orthotics will control it and you'll never have to go to the surgery.
Okay, so you can resolve the pain, but finding style in that resolution.
Well, we have more stylish shoes now.
Okay. And we see some of them here too. We're going to look at some of them, although I don't say there are any 3-inch stilettos there, but nonetheless.
But most of us don't work in the 3-inch stilettos.
Right,
so, you know, those are for church and weddings and funerals and graduations and parties and anniversaries. And a lot of times you're not walking, you know, 2 and 3 miles in stiletto heels.
Right.
So there's always room for the fashionable heels.
And we do have somebody who's going to tell us a little bit about how those orthotics are made too. When people do end up needing to have the surgery now, it used to be a fairly diffuse piece of surgery. You guys use minimally invasive techniques now, things that make it less traumatic to the foot itself?
So the standard bunion correction, and actually the surgery that Jean had, is basically what we call an osteotomy, which is a cutting of the bone in a redirection of this big toe bone. So instead of pointing out, you know, to the side where it's abnormal, we can point it in a straight direction. The change in 2010 is that we're doing these surgeries with improved implants, little small plates that basically improve the patient's ability to rehab. So we're not being as strict, we're not casting after surgery, we're not confining you to crutches for, you know, 3 to 4 months. We're actually trying to get you active, walking on the heel, and get you going much sooner.
Okay. Well, and we have another interesting story, one that is not only a story but a lesson at the same time.
Yes, it is.
Dave, how did you get to meet Dr. Buchanan?
Well, I was cleaning snow off my roof on a ladder.
Ah, what a great idea.
Yes. Yeah. And lost my balance. And at the time, I had the option of either going backwards on my back and my head, which I felt was not really a good option. So I decided to go straight down. And in doing so, most of my weight landed on my left foot.
Wow, great instinct. I mean, truly.
Well,
hard to imagine.
Yeah,
you were fortunate to be able to decide that in such a split of a second.
I marvel about that, but that's exactly what happened. I have to say that, and so therefore, and then I got inside the house where my wife was, and in ensuing that, we went through getting X-rays and going to a couple of doctors. The last one of which recommended the Neufeld practice. So I went over there and met Dr. Borden. Actually, first of all, she saw me and sent me for a CT scan, and they got that, and we went back to see Dr. Buchanan, and then he recommended, well, he had 3 recommendations. He said you could either leave it like it is, because it will heal, but I thought I'd have arthritis, and if I did, then I didn't want that, you know, I didn't want to start that. Or you could have the minimal invasive surgery, or they could cut the heel open and do what they did before the regular surgery. So we went for the minimal invasive surgery.
That seems like a good option. Anything that says minimal and surgery in the same phrase is preferable to traditional.
And it was only 4 1/4-inch cuts, so I was happy with that.
And it worked.
It did very well. In fact, the only pain I had pain obviously when I realized I had dropped on my foot. And but up to the surgery and after the surgery, I had no pain until I started physical therapy, and then, and then I realized that being immobile was not the best thing for your foot. Yeah.
It takes a little time for those things to work out. It always takes time for those things to heal. But I want to know if now he has training wheels on the ladder.
No, he's not even up on the ladder anymore.
Okay. That's what I want to hear. I think that there's a certain age above which you have to be careful. And I think that probably a lot of foot and ankle problems do occur because people have less sensation in their feet. And I guess diabetes is one good reason for that sort of thing. So, but kids typically can keep their balance a little bit better than the adults. The kind of injury he had is pretty unusual. True?
Not really. We see.
No?
I mean,
Okay.
we're the practice where patients
that
we see patients that have fallen. People that have fallen from ladders, fallen from heights and stuff. So, whether somebody's at work's on a ladder and falls off, when someone's at their house changing a light bulb and they fall off a ladder, any fall from height, and actually some of the more serious car accidents can result in the type of fracture that Dave had, which is really kind of a shattering of the heel bone.
And I guess when you land like that, you probably have to transmit some force to your back. You probably have some back injuries that occur in those situations as well.
Absolutely. It takes a tremendous amount of force to shatter a heel bone. So that, when we evaluate Dave in the office, we're checking to make sure he didn't cause a compression fracture in his spine or a tibial plateau fracture or even a hip fracture. So it's a very high energy injury.
And I imagine you were wearing shoes and you landed in the snow.
No, I cleaned off the driveway.
Oh, you cleaned off.
There
Good. That was good.
there was no snow on the driveway, yes,
Right.
so it's good to do that.
Yeah.
And I must say that I really didn't realize how bad the problem was.
injury
I mean,
was.
yeah, I didn't realize it. And in listening to the people here, I have to marvel that this is easy compared to what they've gone through.
And that's true.
It is,
You're lucky,
yes.
yeah.
So,
That's good. Well,
yeah.
good. And I imagine you wear pretty comfortable shoes now. You make sure you have the right kind of cushioning and all those sorts of things
Well,
there. Are you wearing orthotics in your shoes as well?
No.
Okay.
Not,
So you're
not
pretty
yet.
good.
Not
You're
yet,
doing
but
well. That's
I
great.
am, and I walk every morning to
Okay.
keep my exercise up, and that was the thing that really disturbed me the most, is I couldn't walk until I got, through physical therapy and
Right.
could actually do some walking on my feet.
Right. Well, and we have an even more dramatic ankle story from you.
Yeah, I've broken my ankle so many times. I didn't know over the years, I was thinking that I just had a weak ankle. My mom had a weak ankle, and I just had a weak ankle. And the last time that I actually broke it, it turned the ankle all the way around, and had to have screws put in it. Oh. And that was before I met Dr. Buchanan. And over the years, arthritis set in, and I think when I came to Dr. Buchanan, arthritis was really bad, and he had started giving me the shots. And I believe it was like the day after Christmas, I woke up and I could not walk at all. I was in a wheelchair, and I felt that I would have been confined to a wheelchair had it not been for the surgery that Dr. Buchanan told me that I would need.
Right. And of course, you as her daughter, you watched her over the years lose her function then.
Yes,
you watched
definitely.
as that ankle got worse and worse.
Yeah. After Christmas, we were surprised that she didn't rebound. Usually it would go bad, and then about 3 or 4 days later, it would get better. But this time, it just stayed bad, and she was in a wheelchair for about a month. Probably about a month, yeah, before the actual surgery, and then longer after the surgery.
I think Dr. Buchanan also said there were probably from birth that there were 2 bones that I didn't know about, and was probably hereditary even with my family.
Right. So you had some predisposition
Some other issues
to having this
that
happen.
yes.
Did you sprain your ankle a lot when you were young?
Oh, I sprained it, I broke it, yeah.
So 2 things. We were talking about sprains in the ankle, and over time, I guess, you can stretch out those ligaments and have a lot of instability.
Absolutely. So, Carolyn really developed, again, what we talked about, that post-traumatic arthritis. So many years of breaking and spraining the ligaments, you're damaging the cartilage cap that is over top of all of these bones. And the cartilage is literally a living cells. So multiple sprains and fractures, those cells end up dying, and you lose that space between the 2 bones.
And when she would do that, she was talking about little fractures, and so they weren't like these big blatant fractures where you see a big piece of bone. These were probably just little avulsions or little pieces of bone that are being flicked off of the
Chip.
Yeah, just little chips, and they hurt, but they
very
heal.
Painful, yeah.
They heal. You get better, and then you get confident, and then you put on a pair of heels, and You hit an uneven surface and boom, there it happens again.
Actually, when I was working, I was administrative assistant and I gave parties. And a lot of those parties took place on a Friday. And it was good because on Fridays, I couldn't walk again until Monday. So it was a problem.
Thank God for the work week and the weekend. Most people think about going out on the weekends. You just thought about putting your feet up.
Get my feet ready for Monday.
That's right, jeez. So she had a procedure, which is a very dramatic procedure. And I should say that Dr. Buchanan, of course, is one of the few doctors around the country who is certified and qualified to use what are now the 4 major ankle implants. So the ankle replacement surgery is a big-time piece of work. And it's not one that really has had a lot of, let's say, a lot of history relative to hips and then even knees. But tell us a little bit about what we do and what the whole process is like when you do an ankle replacement.
So just like hip arthritis, knee arthritis, when the ankle is so degenerated that we've completely lost the space between these 2 bones like Carolyn had, we can offer a surgery like a hip replacement, knee replacement that's essentially an ankle replacement. So this is actually a bone model of an ankle replacement. As you might expect, this is simply replacing the arthritic joints with plastic and metal. So this is a technology that has been around as long as knee replacements and hip replacements. Its track record just isn't quite as good. So in 2010, we're fortunate to have 4 choices, 4 FDA-approved ankle implants to choose from. But again, this is it's a dramatic surgery that restores the normal joint mechanics with essentially plastic and metal.
And people, I guess, would think, well, it's a pretty artistic free hand that you use when you put these things in. I think that probably the most significant part is making sure that it's anatomically equal to and gives you the kind of balance that you need to be able to use it going forward.
Yeah, these implants have been around since the 80s, and originally in the 80s it literally was a freehand cut that we were just doing, just eyeballing and then making the cut, where now we have these elaborate frames that we put on the leg to make sure that every one of these cuts is extremely precise.
So it is measured, it gives you some parameters to work from, and gives you some reassurance exactly with the imaging that you have now and the measurements you can take and make, much like brain surgery where they literally do it from another room with the Da Vinci now. It's pretty remarkable that you can do that. I do have one more question for you. So, did you have problems feeling balance in your feet? Do you have any problem with blood sugar yourself?
Today, you mean?
Yes.
Now?
Yeah.
Oh, I am fine today. Okay. I'm just sorry I didn't have it done earlier. Yeah. Oh, yeah, it was a miracle. Right. As a matter of fact, no pain at all. No pain I was in no pain. As a matter of fact, the surgery was on the 18th of April, and the 19th of June, we were on the cruise ship.
All right. So
it was just wonderful.
Sounds like it's a little easier to deal with than even.
I had the boot, and I had the wheelchair with me, but I was able to get around with the boot, and
great, fantastic.
It was perfect.
Good. Well, one of the things we were talking about, which I really wanted to make sure we spend a few minutes on, is the fact that people lose sensation in their feet when they have diabetes. And it's a very significant podiatric issue. Tell us a little bit about what happens there with your feet and with your extremities when you have diabetes. I mean, there's something like, what, 25 million people in this country with diabetes? Probably 80% know, but even 20% don't, and they suffer through some of those things. Tell us a little bit about it.
Yes, it's called loss of protective sensation. And basically, protective sensation tells you when you have a crease in your sock or a blister or you step on something. Diabetics lose that protective sensation. They lose it because as the blood sugar elevates in the body, it actually starts to crystallize out like little sugar crystals around the nerves. Those little sugar crystals don't have smooth edges, they're sharp edges, and they damage the lining to the nerve. The nerve is still intact, but the lining is damaged, and so you get an unclear picture going down the nerve, which goes to the brain. The brain can't decipher what the body is telling it and will put out weird sensations. So diabetics have pins, needles, hotness, coldness, pain when nothing's happening, vice grip, just sensations that have nothing to do with what they're doing in their life. and eventually they will go numb so that they lose all of their sensation. Well, they don't have anything to tell them that they have a blister on their foot, or they have a sore on their foot, or their shoe is not fitting properly, their sock is rolled up. And so, as she was saying, someone was talking about when you live by yourself, if you're not in the habit of checking your foot, you just ignore it or you don't feel it, so you don't look at it. And sooner or later, a friend will come by or a family member and say, oh, did you know your toe was dark? Or you'll pull off your sock and there'll be a pool of blood in your sock, and then you look at the bottom of the foot. And ideally, we're trying to get diabetics before they get to that point.
So that's even people with type 2 diabetes that start to see those changes. So that the blood vessel and the actual immunity, because of their basic support of that tissue down in the feet, and their loss of sensation, they get the injuries, they don't really know about it, they get infections, they continue to traumatize them because it doesn't really hurt. And so you recommend people, when they start with diabetes, that they should get some education, and they should probably establish a relationship with a podiatrist like you.
Exactly. With the nutritionist, you want to get in to see somebody who is going to check your foot. The American Diabetic Association recommends that if you are a well-controlled diabetic, that means your blood sugars are perfect, your doctor is happy with where they are, you still need to see someone at least twice a year. That's every 6 months. If you have out-of-control blood sugars, your blood sugar is not being controlled well, you're having problems, you're starting to see signs, then you need to come in even more often than that. Then couple diabetes with poor circulation, things like atherosclerosis, PVD, then you may even need to come in more, because now you're getting actually skin changes, so you don't even have the normal body protection that you would have.
And I imagine also, if you can't feel very much, that cutting your nails is a little bit dangerous too.
It is very dangerous, especially, you know, with diabetes, you know, your eyesight is affected.
Right.
So you may not be able to see clearly. Your foot is further away. You can't get your foot in the right place, or you can't get your hand in the right place. You may not even have the right instruments. Unfortunately, we hear people using pocket knives and all kinds of tools on their toenails. And so, of course, when we see them, they've cut nails, they've cut skin, and ulcerations.
So, word for the wise, we have to make sure that if you know anybody with diabetes, or you do have diabetes, that you have to make sure you take good care of them. Now, you had a bad ankle sprain.
Yes.
We've heard about sprains.
Yes.
How did you do it?
I actually took an awkward step getting out of my car, and my foot went in one direction and my ankle went into the other. And I didn't think it was that bad, but over the weekend it continued to swell. It was very hard to put all my weight on my foot and walk. And so I was able to get into the practice and found out after x-rays that I had torn ligaments in my right ankle. And so ended up having to do physical therapy for about 6.5 to 8 weeks.
Okay. And what kinds of things did you do with the physical therapy?
With my physical therapy, I actually did the Wii, which I
All right.
Nintendo
Who
Wii,
would
which
have expected?
I never ever thought
Were you
that I
into video
could.
games as a
Not at
kid?
all.
No?
Not at all.
Okay.
But I had no idea how a video game would facilitate in my rehabilitation. But I'm like, you're the expert, you know. So along with home exercises and strength training, we actually helped improve my balance, because while I was in the shoe and the swelling was going down, I actually was putting all of my weight onto my left foot, because when I put all my weight on my right foot, it was very, very painful. So we actually helped with the yoga poses and the little teeter-totter game to get my balance back to where it was, so I could get into my cute shoes.
Great. Well, and Matt, you're a physical therapist, and you've been taking care of people with ankle sprains for a long time.
Yeah.
What's the hardest thing for them to recover, and where does it mess up?
It's really the proprioception.
Yeah, so they just can't feel their place in space.
You know, we use a lot of vision to tell us where we are in space, and patients have a tough time finding where that center of balance really is. So we're using the Wii as a nice visual feedback to show them, here's where you're putting the weight, or here's where your center of balance. And it's fun. It's a great game to be able to play and enjoy, and come to physical therapy to relearn where your center of balance really is for you.
And it's really important in terms of getting those muscles to work and to keep you from spraining again.
Yeah, balance uses all those ankle muscles, those little muscles to stabilize the ankle so that you're not misstepping or balancing or falling over.
So we used to use things like a wobble board, these things where you'd sort of try to keep your balance, but this works better.
Well, we use the wobble board as well, but the nice thing is that we work with all of those old pieces of equipment. We can stack those right on top of the Wii to really give you a nice center of balance, or a nice challenge with your balance, and then visually see kind of where you are in space, and the patients are able to really respond to that and find their center.
It looked fascinating because I was watching other people do it, and I was hoping that Mark, who was my physical therapist, would put me on the Wii, and sure enough he did. And it was fun. Great fun. You never outgrow your love for games.
So you have one set up here.
We do.
Show us how that works.
So we'll go into a little yoga pose.
A yoga pose?
Sure. You gonna demo for us?
I'll try, sure, why not? We'll see how it works.
I'm gonna step right on there.
Okay, yeah, all right, here we go. So I'm using...
It's gonna take a little...
I'm making an excuse before I have to show my inability to do this. But is this good for skiing and getting ready for all winter sports or anything else?
Great pre-season thing for you to get in shape for skiing.
All right, that sounds great for me. Like to ski. I understand you like to bike.
I do.
You did a 3,000-mile bike ride one afternoon?
We had a couple friends. We did a little fundraiser for Children's Miracle Network at the end of med school and rode our bikes cross country.
Wow.
So.
And it was one afternoon? Is that what you said?
It took 7 weeks of consecutive afternoons.
I see. Okay. All right. So
we're following the little instructor
here. I am.
She's going to do a tree pose.
She is. Okay. A tree
I'll
pose.
let you follow along with her.
Watch my move. Oh, jeez.
Maybe a tough one to start off with. I'll let you go easy. Just holding the arm. Yep.
There we go. How about that? Was close.
Just go ahead and lift the foot up.
I'll try the other side. Maybe it works better.
And you are the red circle.
I am. Okay.
And you're trying to keep it right in the middle of the yellow circle.
Okay. Let's see. Let's keep it right there in the middle.
There you go.
All right.
So by using that visual feedback, we're able to show the patients kind of where their center of balance is.
Well, that does help a lot. Actually, and I could feel my ankle really working hard. Thanks. No problem. That's great. Not bad. Not bad. Yeah. Well, for my encore, I could fall on my face, but I'm not so sure I want to do that. But in conjunction with what you do there, and I know that you have an extensive, actually, you have a gymnasium pretty much set up there in the office for the various types of injuries that you deal with. But one of the more important things you do is fix the feet and make sure that they're stable. Now, orthotics.
Yes.
Tell us a little bit about orthotics and what you've needed to do to keep your feet going.
Well, she's a miracle worker. I've worn orthotics since '97. I, as a triathlete and run marathons, Ironmans, and I started having problems, and I was very skeptical about coming and getting new orthotics because I had the same pair that I would just refurbish for like 13 years. And so they were very near and dear to my heart. And I only, because they're your feet, you trust certain people with your feet.
Sure.
And so I went to the practice, and after having another foot surgery,
what kind?
Morton's neuroma.
Okay.
Had one in the left foot, had the right foot done in February.
So were you one of those who wore those high heels and those little narrow compartments?
No, it was actually from marathoning.
Okay.
I didn't know that your feet spread and grow when you run, and I kept wearing the same size shoe, and my feet were getting too compacted, and so now I pay really close attention to big toe boxes and things that you need to when you buy running shoes. But so I was pointed to Marcia, and after my latest surgery, well, I started having problems with the right foot again, and thought, oh my gosh, stump neuroma, I don't want to go there.
Right.
And then I started having problems with the right foot and never had problems before. And so finally after the surgery, got new orthotics, and was having a little bit of trouble even with one spot on my right foot that just was it was really painful, and it shouldn't have been. So she worked her magic and customized them a little bit more. And well, that very minute I stood up, no more pain.
You knew.
Yeah, it was great.
So you basically fashion people with orthotics. Obviously, somebody tells you what the anatomy is, but you're pretty versed. You've been a sports trainer. You've gone through a lot of this for many years. And you have, obviously, a pretty interesting table full of, of shoes and different accoutrements that you use to help. And you have molds here that you were going to show us a little bit about.
Well, basically, my job is when someone comes to me is really sitting down and listening to what their problems are, taking a look at their gait mechanics and how they walk, what kind of problems I can see by just evaluating that, and then deciding how I can best help them by changing either the shoes they wear or fabricating a custom orthotic to correct the position that they're having problems. If they're completely overpronated, putting them into a neutral position. In Michelle's case, she had a very tender spot that every time she ran, that one particular area was extremely painful, and it was keeping her from doing her marathons and running. So, you know, once we did the orthotics and put her in the correct positioning, it was a matter of just going in and tailoring the orthotic and offloading one section. And just by doing something simple like that with the correct shoes that she wore, she was back to running without pain.
Right. And I think that probably a lot of people try to do that on their own, and sometimes I guess that can be effective. But as we see, you've got a nice variety of specialized shoes that can help people and can help make their feet more comfortable in their shoes. I know that all of you have had your travails. You've gone through some significant surgical procedures, and you've gone through a lot of rehabilitation. We all have to admire and respect you for that. And Dr. Buchanan, you've had your accolades here. Certainly you've got your patients who recognize and realize that it's a very specialized area, and you've done a lot of work and become very, very competent at being a super specialist in a very difficult area. And Dr. Borden, thank you for being here and telling us about the feet as well. And once again, it's been a pleasure. And of course, it's always a pleasure to have you listen in and to watch the show. But of course, until the next time, I'm Dr. Russell Libby, looking out for your health.